Hi, my name is Ruthie. I'm a CUNY School of Public Health student. This is my capstone project, and the topic will be a training manual, screening for malnutrition in the long-term care setting. A bit about me, I'm a registered dietitian and I work in a nursing home, which is a long-term care setting. I've been researching this topic both in my fieldwork semester and during my capstone semester, so let's just dive right in. So to give you a bit of background, geriatric malnutrition is a challenging health concern associated with high mortality and morbidity rates. It's associated with physical decline, which can impact activities of daily living, such as ability to feed oneself, dress oneself, go to the bathroom, etc., and overall quality of life. Different tools have been developed to screen for malnutrition, however, none have been standardized for the use in long-term care facilities. Screening is a really important process because as clinicians, when we are able to screen people, we're able to identify those who are at high risk and able to give interventions and put more energy into preventing problems for those patients. So screening is so important. And a recent review suggests that a new tool be developed for the nursing home population that contains more items referring to the multifactorial background of malnutrition. Multifactorial background of malnutrition can refer to elements that can impact malnutrition. So ability to feed oneself. If someone can't feed themselves, they're relying on others to get them the calories that they need. If someone can't chew or swallow the current diet texture that they're on, they're going to have a hard time getting the calories that they need in their body. Eating environment can, play a big role. If it's an overstimulating eating environment, someone might not eat as much because they're overwhelmed. Also, certain medications can cause increased appetite, decreased appetite. Certain diagnoses like cancer can put you at risk for weight loss and overall malnutrition. So it's really important to look at all these different factors and see what can be at play. So as we mentioned, none of the screening tools have been standardized for the use in long-term care facilities, including the mini nutritional assessment form, which is this form. This is kind of the best form that we have at the moment. It asks questions on mobility, psychological stress. Is your patient psychologically stressed? What does that mean? Difference between, mild and severe dementia. These questions can be unclear to the untrained eye and even to the trained eye. So we're going to get back to this form in a minute. The methods for my project, a registered dietitian who works in a 180-bed long-term care facility in Queens, New York, collaborated with healthcare workers in the same facility to create an optimized malnutrition screening tool. The new tool will be based on the MNASF, which we saw on the last slide. The RD surveyed 24 healthcare workers from different clinical disciplines on their thoughts of the MNASF, and the survey questions asked about clarity of questions, the perception of ability to obtain the information of the screening questions, and what they thought that the screening tool didn't ask but should have. And based on this feedback, a new screening tool was created, ensuring the questions were clearer, easier to answer, subject to less interpretation, and more inclusive of the multifactorial background of malnutrition. So here we can see the initial survey results asking about the MNASF. People didn't seem super likely that they were confident they can obtain accurate information prior to admission on declined intake, weight loss. They couldn't differentiate between severe and mild dementia or define psychological stress. Moving on, we can see that a lot of healthcare workers thought that a bunch of different topics should have been included but weren't, such as presence of pressure ulcers or wounds, use of certain medications, depressions, cancer diagnoses, diet textures, etc. And the major findings of this survey was that the information requested by the MNASF tool was hard to obtain. They had a difficulty understanding what some questions were asking, and it just took too long to use. So based on that feedback, this new tool was created to clarify some of those issues. And this tool was validated against the mini nutritional assessment short form, and it asks 3 questions. Which one, is more, how hard is it to obtain the information? How clear are the questions, and how long do each of them take to use? The survey was given to the same healthcare workers, asking them to answer these 3 questions for each form. And for the validation survey, we can see that the new form is much easier to obtain the information requested from the tool. It's a lot more clear, and it takes less time. So moving on, the purpose of this project was to identify some easily implemented solutions to the major problems posed by the current geriatric malnutrition screening tools. A new tool was designed that requested patient information that was simultaneously more readily available and more relevant to nutrition screening to reduce the difficulty in obtaining information. The new tool was crafted with simplicity and clarity of language to ensure that any healthcare worker could easily and quickly comprehend what information to gather. And these adjustments also dramatically reduced the amount of time healthcare workers perceive the tool required, reducing frustration and encouraging utilization. The limitations of this study: it was a pretty small sample size, only including 24 healthcare workers. Participants were not distributed evenly by age, gender, or profession. All the participants were between the ages of 30 and 65 years old, and the majority of these participants being female and nurses. And not only were the majority of participants nurses, but all participants were active healthcare workers. In conclusion, malnutrition is a pervasive issue throughout the elderly population. A recent systemic review suggested that a new tool be developed for the nursing homes population that contains more items referring to the multifactorial background of malnutrition in this specific population. Items such as intake, feeding ability, presence of pressure ulcers, presence of chewing or swallowing problems, eating environment, as well as general anthropometric factors were included. And this manual did exactly that, producing a more comprehensive screening tool to screen for malnutrition in the long-term care setting based on previously tested tools. However, more research is needed with a larger sample size and a greater variety in servant participant demographics. So that concludes the first part of my capstone project, and that goes through the research of how this project was developed, the methods that were used, the surveys, the validation, and the next part of my project is going to be the actual step-by-step guide on how to screen for malnutrition in the long-term care setting. And this guide is a manual designed with all of this information. It is self-explanatory. Anyone can pick it up. It's designed to be used by anyone who works or volunteers in a long-term care facility. It's especially helpful for those who don't have a formal background in nutrition, including but not limited to nurses, physicians, social workers, physical occupational speech therapists, students, and volunteers. And given that the guide is self-explanatory, it's able to maximize the utility of untrained staff, such as students or volunteers, by allowing them to perform the screening process, which would otherwise occupy the valuable time and attention of licensed professionals. So this project is very near and dear to my heart. I hope that this manual can be distributed to long-term care facilities and help identify those at risk for malnutrition and improve patient outcomes. Thank you so much for listening to my project. My email here is listed below if you have any questions, comments, concerns, feedback that you'd like to share with me. Looking forward to hearing from you all.